Please do not believe a myth where breast cancer surgical treatment is concerned. It may make so much difference in your life and survivorship after completing therapy. So what is this myth I am speaking of? The Cambridge English Dictionary defines a myth as a commonly believed but false idea. If it is false, then it is a lie. The sad thing is that evidence shows that many women with early-stage breast cancer believe a lie. In 2016, Dr. Beryl McCormick from Memorial Sloan Kettering Cancer Center spoke of the mastectomy myth. In her words, there exists a myth supporting an aggressive surgical procedure, which is mastectomy. What about more recently? Is there still a myth supporting mastectomy? If so, should it be recognized as untrue and harmful? Before we move on, allow me to put this comment into context. The options for the surgical treatment of breast cancer can be classified into two broad categories. The first is breast conservation treatment. This involves the surgical removal of the cancer with a rim of uninvolved breast tissue all around, usually followed by radiotherapy. The operation may be referred to in several ways, as breast-conserving surgery, lumpectomy, wide excision, segmental mastectomy, and partial mastectomy. These terms refer to the same procedure. The other group of surgical operations is a broad group termed mastectomy. This involves surgery to remove the breast and may be done in the standard manner, or using skin-sparing or nipple-sparing approaches. Women may elect to undergo reconstruction after. Historically, before the mid-1970s, mastectomy was the only form of treatment. However, with landmark publications of research performed comparing mastectomy with a less mutilating surgery, breast conservation treatment in 1991, the National Cancer Institute issued this statement declaring that breast conservation treatment is an appropriate method of therapy for women with stage 1 and 2 breast cancer and is preferable because it provides survival rates equivalent to those of mastectomy while preserving the breast. For the history of how this came to be, please watch this other video. Returning to the comments of Dr. McCormick about the mastectomy myth, we will discuss and discover in this video, firstly, the evidence of persistent and prolonged increase of mastectomy rates in the era of consensus recommendation for breast conservation treatment in certain geographical regions. Secondly, we will cover research data which led Dr. McCormick to make such a comment in 2016 and whether it is still relevant today. Thirdly, we will cover what a patient can do for herself. Finally, there is a surprising secret which I will unlock at the end of the video. Please note that this information is for educational purposes only and is not intended to replace a medical consultation. In covering the first topic, allow me to present this 2009 study from Florida as evidence that starting from 2004, there was an increase in the percentage of women who underwent mastectomy. Based on the timelines, we will note that this was more than a decade after the consensus statement by the National Institute of Health was made. Is this only limited to the past? Let's take a look at the research published in the years that follow. Consistent with data published in 2009, in 2025, this team of doctors from the University of Texas, MD Anderson Cancer Center, published their data which found that rates of total mastectomy, abbreviated as TM in this article, increased from 39.7% to 59.9% for patients who were younger than 50 years of age in the period 2005 to 2013. In this separate study from Tennessee published in 2024, it was found that between the years 2017 and 2021, patients were increasingly choosing to undergo double mastectomy for single-sided breast cancer at one institution in a rural setting. Contralateral prophylactic mastectomy is the removal of the unaffected breast at the same time as mastectomy for the breast with cancer. As we see over a period of 2 decades, these doctors report a tripling of the percentage of women choosing to undergo double mastectomy. So we have covered the research data which shows evidence of increasing mastectomy rates in certain treatment centers. Why is this increase a concern? To answer this question, we will first return to the comments by Dr. McCormick. Her article was an editorial analyzing the study published in 2016, led by Dr. Van Maren, which demonstrated that breast-conserving surgery plus radiotherapy showed improved 10-year overall and relative survival compared with mastectomy in early breast cancer. Back to the excerpt we earlier discussed, having had what Dr. McCormick considered to be emphatic evidence, she stated that a myth supporting an aggressive surgical procedure that is less effective for breast cancer cure than is breast conservation surgery plus radiotherapy should be recognized as an untrue and harmful belief. Dr. McCormick's editorial was published in 2016. What about more recently? An expert panel that convened at the 2025 edition of the St. Gallen International Breast Cancer Conference believed that patients should be advised that breast-conserving surgery and radiation therapy is usually the best treatment option with comparable or superior cancer control results, less morbidity, fewer complications, and favorable patient-reported outcomes. So for nearly a decade, the message from experts has been the same. For comparable or superior cancer control, breast conservation treatment can be performed with less morbidity, fewer surgical complications, and favorable patient-reported outcomes. Perhaps this is the reason why Dr. McCormick stated in 2016 that it can be harmful to support the use of mastectomy over breast conservation treatment. So, what can a patient with early-stage breast cancer do? There is another video where I have explained the questions a patient can ask to find out if she is eligible for breast conservation treatment. The link is provided in the description below. If your surgeon has said that you are not a candidate for breast conservation, you have the option of a second opinion. How does this help? Breast conservation rates are different in different institutions and geographical locations. Do not take my word of this fact at face value. Verify the references provided in this video to satisfy yourself. There are also many other videos on this channel which provide references to multiple studies which demonstrate improved survival with breast conservation treatment. May I also encourage you to check and verify them so you can trust the data. If we were to review available medical literature, we will find several studies demonstrating a difference in breast conservation rates. In the interest of time, I will just highlight two in this video. We will recall that in this study from MD Anderson, mastectomy rate was reported to be 59.9% in 2013. In this other study conducted just a few years after, breast conservation rate was 59.9%, meaning that mastectomy rate was 40.1%. Therefore, in different treatment centers and locations, the rate of mastectomy can differ. You might be among the approximately 20% of patients who may be offered breast conservation instead of mastectomy just by seeking a second opinion. This team of Chinese researchers found that surgeon recommendation for breast conservation surgery had a positive relationship with a patient undergoing breast conservation surgery. Therefore, surgeons with a strong preference for breast conservation treatment, like me, may have some influence in promoting conservation. I promised you a surprising secret at the beginning of this video. Here it is. This team of Swedish doctors found that women with disease that has not spread to the lymph nodes and who undergo breast conservation surgery with radiotherapy have a relative survival gain of 56 to 70% over those who undergo mastectomy. This data is corroborated by a Chinese group of doctors who found that among their study participants, the survival time of patients who underwent breast-conserving surgery was significantly longer than that of patients who had a mastectomy. So, with all this research data now in your possession, if you have been given the choice of whether to undergo breast conservation treatment or mastectomy, you are now empowered with real evidence not to believe a lie. I trust it would help you make the right treatment decision for yourself to live longer and live more after breast cancer treatment. Thank you for watching this video until the end. If you have found the information useful, kindly like, share, comment, and subscribe. Your engagement will go a long way to motivate me to create videos which help women make evidence-based choices for their surgical treatment of breast cancer. I hope you will join me in my other videos. Until we come together again, take care.